Now, have you had a cesarean section before? Or do you even know someone that's had CS in the past? Do you know that there's no actually a specific number of cesarean section that you can have? Now, there's no maximum to the number of cesarean section you can have. That's the topic we are going to be discussing today. So why do we say that you should not have more than a few number of it? So, as we all know, cesarean section is a common thing. It's a common, like the commonest or about the commonest procedure that is performed on pregnant women. And the aim is actually to deliver the baby whenever it cannot be delivered through the vagina. As I've said, there's no maximum cesarean section that we can say the patient should have. I mean, there's no limits to the number of cesarean section you can have. But the truth of the matter is, the more the cesarean section a patient has undergone, the higher the risk that this patient, of course, is exposed to. What am I even saying in essence? In some environments, maybe because of some reasons, patients, they have had up to 11 cesarean sections. They have had up to 10, 12. I have some of my senior colleagues that have performed up to 10 cesarean sections on a particular patient before. But in our environment, you hardly see people go beyond the 5th cesarean section, or by the time a patient is going for the 3rd or the 4th cesarean section, that patient is already high risk in our environment. Why? As we all know, our environment is so peculiar. We have a peculiar environment whereby sometimes when you need some things, you can't just get them easily. Take, for example, you have had a few number of cesarean section, and at this particular one, there's need for blood transfusion. Have you even heard about people that need blood and they don't even find someone to donate for them? It's not a big deal donating blood, but people in our environment just feel that donating blood, and before you see anything, they would have run away. Even cases of husbands that have been called to come and donate for their wife, and they will run. So what we are saying in essence is, getting blood in our environment is not something that easy. Now, because of this reason, we may say that maybe in our environment, we should just peg the number of cesarean section to a particular number. But still, nobody can come out to say categorically that maybe you don't have more than 4, don't have more than 5. We can only advise that by the time you're having the 3rd cesarean section, the 4th cesarean section, man, you have to be very sure that you are not written letter to death. Because apart from bleeding that you may need to be transfused for, there are some bleeding that even blood transfusion cannot even solve. Yes, there are some bleeding that blood transfusion cannot solve. How easy can you say you want to get 10 units of blood to transfuse a patient? It could be that bad that a patient will need as much blood as that. That's the truth. Even if you have all the money in this world, or better still, you are in a facility whereby everything can be done. Don't forget the side effect of blood transfusion also. Infection, the fact that those blood, they have to be given within a short period of time. It means that complications of blood transfusion can easily come up. Electrolyte imbalance, transmission of infections, congestion of the heart because of that blood transfusion can occur. So you can't just say you can have blood easily. You don't mind going for the 5th, the 6th, the 4th cesarean section. No, now you have to be very sure. Then another common complication of repeat cesarean section is a condition that we call adhesion, severe adhesion. Now, my Yoruba people will say that ojuapa, kojojuara. That in essence is that whenever there is an injury, there's usually a fibrotic leftover. and it cannot ever be repaired. It cannot like heal totally as a brand new structure. So what we are saying in essence is sometimes getting to that baby may even be very difficult. I mean, before the surgeon can reach the baby to be delivered, you might have damaged a lot of things. Don't forget, the womb is very near to structures like the bladder, which is the house for the urine. It's also very near to structures like the ureter, which passes urine to the bladder. So a lot of damages can even occur even before you get to the baby. And sometimes the baby might have even died before bringing out the baby. Because of this, few cesarean sections, say like 3 is good. Then when you are doing the 4th cesarean section, you should know that you are putting your life at risk. The truth of the matter is also that there are some conditions that could occur with repeat cesarean section. Have you heard about like placenta coming forth before the baby? Meaning that the placenta is at the mouth of the womb. And in these cases, it will be very difficult for that mouth of the womb to close back, even when cesarean section has been done to deliver such baby. And this condition increases with increase in the number of cesarean sections that you have had. So apart from this placenta that we are even talking about may just like invade. Placenta should just adhere to the placenta, to the uterus, to the womb. Likely that can easily be separated, but because of the previous years that the patient has had a lot of fibrotic changes, of course the placenta will want to like place itself in a very nice place, and at the end of the day it may place itself in a place whereby there may not be good contraction. This contraction is meant to control blood, but if you don't have enough of it following CS or following even delivery, it may bring about excessive blood loss. Now, there's a condition we call placenta accreta. In placenta accreta, the placenta is in fact aggressively adhered, like morbidly adhered to the uterus, whereby it cannot easily be separated. In that case, placenta may even go in, meet other structures after leaving the uterus to have gone to other things. Placenta accreta is something that occurs with increased number of cesarean section. And of course, do you even know that the uterus can just like open up, give way, that we call uterine rupture, with multiple number of cesarean section? And this can even occur when the woman is not even in labor. So that is why when you keep having cesarean section, you are at risk of a lot of morbidities. So that's why at the end of the day, your obstetrician may say I have like 3 CS, maximum about 4. It is not that there is a particular number, a specific number that you can have. But because of all these complications, we have said that you should limit your number of cesarean section to about 3 or 4. So my sister, in case you have someone that's had CS in the past, or even yourself, you have had cesarean section in the past, it will be honorable that you limit your cesarean section to just about 3, maximum 4. Beyond this 4, man, you're on your own. No. We have been able to take ourselves through some of the disadvantages that are there in having a lot of cesarean section. Now, if you are new on this channel, I want you to kindly like, share, subscribe. In fact, kindly comment. The more you do all these things, the more you give us the opportunity to reach a lot of people. They can learn from at least 1 or 2 things that we know, so that people will benefit and have a lot of idea about their health issues. I am Dr. Adeniro, your consultant obstetrician and gynecologist. Kindly like, subscribe. In fact, subscribe now. Don't forget, I said you should subscribe now. Subscribe to my channel so that I'll be able to reach more people. Thank you for joining me.